Hello and good afternoon to one and all. I, Dr. Asawari Savant, on behalf of Voice of Healthcare, welcome you all to the Connected Health Summit on the occasion of World Health Day. For this live panel discussion, we will be talking about future of healthcare. In today's post-pandemic era, connected health and digital health tools play a significant role in enhancing the patient engagement, patient access to care, and patient empowerment. So, our main focus for this live panel discussion is to explore telehealth and remote health monitoring options in healthcare and talking about the latest adoption of these technologies to monitor patients for enhancing clinical outcomes. Our another focus is to design healthy habits for healthier outcomes, exploring how healthcare is delivered now and what lies in the future of connected health. For this summit, we have leading experts with us here today who would be deliberating and engaging in impactful discussions to explore newer facets in connected health. So please allow me to welcome Dr. Suchismitha Rajamanya, who is the consultant of internal medicine at Manipal Hospital, Whitefield. Welcome, ma'am.
Hi, thank you.
I welcome Dr. Davender Singh Chadha, who is the consultant of interventional cardiology at Manipal Hospital, Old Airport Road. Welcome, sir.
Thank you.
I also welcome Dr. N. Raghunathan. He is the consultant neurosurgeon at Manipal Hospital, Salem. Welcome, sir. I also welcome Dr. Upendra Shenoy. He is the consultant cardiothoracic and vascular surgeon at Manipal Hospital, Mysore. Welcome, sir.
Thank you very much.
Unfortunately, due to some patient emergency, Dr. Pramod Krishnan, who is the head of the department and consultant of neurology at Manipal Hospital, Old Airport Road, would be joining us after some time. So, without further ado, let us start with this session and start with Dr. Suchismitha. Ma'am, how does remote monitoring of heart rate, oxygen saturation levels, and activity metrics such as sleep quality, steps, and pain score, etc., help in enhancing the overall clinical outcomes in your experience?
All
Over
right,
to you,
see.
ma'am.
What basically happens is we have patients who come with acute cases who are hospitalized. We also have many OPD-based patients, who are basically dealing with chronic diseases. It could be diabetes, it could be blood pressure, or heart-related issues. So whenever they are hospitalized, whatever may be the reason, if they are posted for a surgery or if they are admitted for infections or any other medical management, we do monitor their vital parameters like blood pressure, pulse, saturation in the hospital. Necessary interventions are made whenever there is any abnormality in those cases, and sometimes these are life saving. Now, of course, when the patients get discharged for whatever reasons, this becomes difficult. It becomes difficult for the patient to monitor, for the patient to take the necessary measures to seek out help. It becomes difficult for the doctors also to make the necessary changes in their treatment plan to give the emergency treatment required. So that way, remote monitoring of patients has helped us a great deal. So we've had many patients who are, who undergone, let's say, a bypass surgery or an angioplasty or TKRs, and we've had patients, especially with COVID in the present pandemic, who required oxygen and were in the hospital for a prolonged stay. So when such kind of patients get discharged, there's a lot of doubt and ambiguity, and they're always insecure about how they will be managed at home. So utilizing this remote patient monitoring has helped us alleviate their fears to a great extent. It helps us to make the necessary treatment decisions. It builds a lot of patient confidence. It empowers them also. And when we are updated about their pulse rate, their oxygen, or their blood sugars, their blood pressure, all the necessary interventions can be made. It avoids all the needless ER visits. It avoids most of the readmissions to a great extent. So that way it's been very beneficial. And considering all the non-communicable diseases, whether it's diabetes or obesity and coronary artery disease, So a lot of it depends upon the lifestyle changes that we bring about. So patients feel empowered monitoring the amount of activity that they're doing, in terms of the diet that they're consuming, the amount of exercise they're putting in. So, and also monitoring the sleep pattern, because insomnia also is one of the leading factors to aggravate diabetes and blood pressure. So, in this regard, when patients are able to see how much they're able to achieve in their lifestyle changes and exercise and dietary changes, it also again empowers them, and it also informs us as to what necessary intervention we need to do from our end if the patient is able to do it from their end. So these are the many benefits of using a remote patient monitoring. So overall, it helps in a comprehensive care of the patient, and I think it builds the patient-doctor relationship. It increases the confidence that the patients have, and I think it's about empowering them so they can make informed treatment decision. So these are all the benefits that we are seeing.
So very nicely explained, ma'am. Thank you so much. You explained it so well. And other than that, I feel there is also this aspect of patient education which gets imparted so that the patient feels empowered now and knows why these, metrics, what these are doing and how is it affecting and what sort of good lifestyle habits they can include as well. So definitely that is very effective in for future as well. So coming on to Dr. Davender Singh Chadha, sir, my question would be for you, how can we ensure continuity of care post high risk surgeries such as post surgeries of angioplasty, cardiac bypass surgery, etc.? How can we ensure the continuity of care with the help of such wearable health monitoring devices? Over to you, sir.
All right. Thank you, Dr. Asawari. One important aspect which I would like to highlight at the beginning is that we are just doing point care treatment. When we take the patient up for angioplasty, we just open the block, but that does not mean that the block will not recur. So disease is a continuum. And what is most important is that the attributes or the risk factors which lead to the disease have to be controlled well. And these risk factors, which have to be controlled, require considerable patient education, wherein patient has to be sensitized and he has to be told that these risk factors have to be controlled using medication and lifestyle measures. That is one aspect. The other aspect is that patient is educated in terms of uh, the heart rates and the blood pressures which he has to maintain. We know that hypertension is one of the major risk factors, and as was explained earlier in this show, that if your sleep rhythm is not normal and if you're not sleeping well, you will certainly have raised blood pressures in the morning. And also that will lead to increased heart rates, and as the heart rates go up, the nutritional requirement of the heart increases, and if that increases, you put more stress onto the heart. So it's very important when we discharge these patients, we give a list of medication which they have to continue, and in this list the important drugs include drugs for controlling the blood pressure and the heart rate. Now, there are two components. One is monitoring this remotely, two is educating these patients. So there is a fair bit of telemedicine component in this, wherein the patient has to be in touch with the treating doctor or the team, and patient has to be educated in terms of what drug is meant for what. 8 out of 10 patients who get discharged are not aware as to what drug is playing what role, and they are absolutely not informed about it. In addition, they are also not aware as to what is the kind of physical activity they have to undertake and the quantum which they have to undertake during course of 24 hours. We also define certain target heart rates which have to be achieved. So if you have a remote monitoring device which educates the patient or tells the patient that, okay, your heart rate during the course of day was in X to Y range. So we as cardiologists like our patients to maintain heart rate somewhere between 60 and 75, not higher than that, because that increases additional burden. So if we have a device which tells us that the heart rates are going in a particular range, we can modulate the therapy. In addition, we also educate the patient in terms of physical activity. So if we have a monitoring device which tells us how many steps did the patient take during the last 24 hours, we can again educate the patient, because these are very important things. The sleep pattern, if a device tells us whether the patient had sound sleep or there is some disturbance, when you come out of a cardiac ailment, you are stressed, the family is stressed, and if you give these patients some feedback through a remote monitoring device that you are doing well, you are actually doing the amount of physical steps which you are required to do, and your heart rates are under control, and your blood pressure is under control, that is a very important positive feedback which the patient gets. And it improves the compliance with medication, which is a very important thing. You might write 6 drugs in the discharge note. The patient might not believe in these drugs and might stop taking after 7 or 10 days. So it's very important that we kind of continue the counseling through an objective tool, which is a remote monitoring tool which brings objectivity to the monitoring. Most of the time patient says all is well, but if that is supported by some facts and figures, the doctor also sleeps well, and the patient and the family also sleeps well, because they feel that justice has been done, and they are doing fine. So I would reiterate that we need such monitoring devices, which probably puts the patient back on road to health, and it's good both for the patient as well as for the doctor.
Definitely, sir. So very well explained, and such simply explained as well. Definitely, as you said, that disease is a continuum, and continuing that reassurance and just staying in touch with your doctor through these remote monitoring devices, and getting the advice from a specialist, from your doctor itself, that, oh no, these are normal things that you're going through and that is fine, is very assuring, very important for post care as well for patient. So definitely these are very helpful. My next question would be to Dr. Raghunathan. Sir, what advantages have you seen in neurosurgery of using such remote monitoring focused devices for improving and the quality and efficacy of care post neurosurgery? In your experience, what have you observed? Over to you,
Hi.
sir.
Hi. Telemedicine has been adopted in several domains of the surgical care. In recent years, its role in the post-operative care has got attention, as it has demonstrated excellent clinical outcomes and enhanced patient satisfaction and increased cost effectiveness associated with the reduced patient waiting time and cost savings both from the patient and healthcare systems as well. So coming to the post-operative care, sorry. Coming to the post-operative care, it can be utilized for monitoring the patient's clinical progress and wound status and treatment modifications, like suppose in case for tapering of the steroids or discontinuation of specific anticonvulsants or tailoring of the painkillers, and then other factors such as the patient's when is the expected date of return to work and other functional status evaluation can be done in the immediate post-operative period. Suppose, for example, if we could see the patient's wound status through the images shared through the video conferencing or the messenger apps, you could see there's any wound tenderness, wound collection, drainage, and also we could suggest a suitable date for suture removal as well.
Thank you so much, sir, for so nicely explaining that. Definitely, there are many advantages of using such devices, as you shared, in remote monitoring for neuro and neurological diseases. Other than that, there was this question that I was really keen into, and just a burning question that I had, that up till now, how the things have been done, how monitoring have been done, the traditional method of monitoring, and versus this new remote sort of monitoring. What all are the major things that you have seen are better in this, and as well as where do we still lack? What is the scope of improvement in your opinion?
Actually, basically, this since there is a lack of neurosurgery facilities in the nationwide, they're located in the urban areas. These facilities are lacking in the rural areas. So these intensive care units, digitized waveforms such as EEG, intracranial pressure, and cerebral perfusion pressure can be coupled to the computer software, which the physicians can access remotely, and then he can have a tele discussion with the trained doctors or the physicians or the surgeons on the other side, so that they can treat the patient accordingly. So a new subspecialty like tele neurotraumatology and tele AE intensive ICU is coming up. So in future we can expect those platforms to get more improvised and innovated, and then we could utilize it as well, so that we can we can triage the patients. We can even before we can have a tele discussion with the consultants on the other side before shifting the patient. And most of the, for example, most of the head injury patients doesn't require any surgical intervention. So in the rural areas, if the patient can be managed in the rural setup, they need not be patient transferred to the urban area, thus reducing the workload for the neurosurgeon in the tertiary care hospital.
Definitely, sir. So very well shared. It would definitely reduce the workload of the tertiary care neurosurgeon, as well as make the whole entire process very streamlined as well, and more accessible to patients on, on the grassroots levels as well, we hope. So my next question is to Dr. Upendra Shenoy. Sir, wireless remote monitoring devices in cardiothoracic and vascular surgeries, how effective are these in your opinion, in your field, and for especially for patients, for regular monitoring, for enhancing their clinical outcomes post treatment? Over to you, sir.
Hi, thank you very much, Dr. Savant. Like Dr. Chadha had very clearly said, what is the advantage of post procedure care, either in cardiac angioplasty or in bypass surgery. Uh, I think first is to reassure a patient that he is doing well. Number two is reassess and make sure, reconfirm that he is taking all the medications. This is what Dr. Chadha also was mentioning. And this is exactly what we want in post cardiac surgery patients also. So, see, if a patient is not controlling his diabetes well after cardiac surgery, you will find his sugars are all over the place. And then within a week or two, when he comes back, you will find his wound is infected and there is pus pouring from the wounds, for which, if we had monitored during this period his blood sugars, and we had advised him on his diet, we had advised him on his fluid intakes, we would have been definitely in a better situation in a week or two. So I would say basically by doing telemedicine, we can look at all the vitals. We can, of course, look at his blood pressure, we can look at his heart rate, we can look at his temperature. If the patient is showing swinging temperatures, then maybe he is going to have some infection. It is better to call him in and start him on some IV antibiotics if required. And we can also look at his blood sugars. If they are on blood thinners, if they are on warfarin, acetylcholine, we can give a coagular check in addition to this, and we can also get remotely his INR ratio. And that will give us an idea whether he is taking enough of warfarin, whether we have to adjust the dose of warfarin or acetylcholine. This is very important, especially if a patient is in atrial fibrillation and if there is a possibility of him throwing certain emboli. We will definitely like to monitor and make sure the INR is in therapeutic range. Not only this, we can also have a look at the wound. We can have a look at his nutritional status. Many patients post-operatively tend not to eat. They are scared to eat, they're scared to drink. And all this causes dehydration, hypernatremia because of all the medications that we are giving. So we can assess all those things. We can look at his pain, and we can assess his, we can do a pain management by telemedicine. So overall, I think by continuously monitoring the patient in the post-operative period when he is at home, not only we can make sure the medications are being taken properly, that the patient is moving in the right direction, and if we find that there is any disturbance, we can always call him in and put him back on the right course.
Great, sir. That was so informative, so insightful. All the things that you shared about this thing. My next question is to Dr. Suchismitha. Ma'am, in your field of internal medicine, what all are the remote monitoring devices that you have seen working very effectively, other than simple tracking your steps, your sleep, and other than these, any other devices for detecting other parameters that you have been using, or do you foresee coming out which would be effective, especially as you have seen post pandemic era, people are and doctors and healthcare experts are diving more into the technology aspect of healthcare. So what all methods do you see being adopted in future for the for good care, effective care digitally? Over to you, ma'am.
Yeah. So the pandemic basically has brought about a paradigm shift, in the way telemedicine is being used, and it's helped us a great deal because previously, whenever the patient was discharged after medical management over here, be it because of pneumonias or be it because of dengue or gastroenteritis or poorly controlled sugars, the only way that we could follow up with them was on their OPD visits, or if they would visit the ER because of some emergencies, or sometimes we did have a follow-up system of calling the patient, over phone, asking them how they were doing. So telemedicine that way has changed everything. And right now, with the easy availability of all these devices, we are of course using the glucometers. We have the patch glucometers, the skin patches, which give us a real-time reading of the blood sugars of the patient. It helps us by giving us a great deal of information about what kind of food the patient had and what kind of fluctuations were noticed, the kind of activity the patient was doing, hypoglycemic events. So it helped us tailor the patient's the medical facility or the treatment that we were giving the patient to a great deal. But after the pandemic, we are seeing a lot of utilization of heart rate monitoring, of pulse oximeters, being used to monitor the saturation. We've had patients measuring their blood pressure too. So these are the most common ones that we are foreseeing. And yes, we've had information from the gynecology team also, where they've used the fetal and maternal monitoring system also to see how the heart rate has been and when the patient should come down to the emergency department. So all these aspects are being used currently. We hope that going forward we can see more advanced things to see the patient's breathing patterns, apnea meters, to measure the INR, as Dr. Shenoy was saying, and also the drug levels to assess if the patients were taking their drugs, whether they were compliant with the drugs or no. So we hope that these devices could come up in the future.
Thank you so much, ma'am. That was really insightful, and it gives us a scope to improve as well as look what we already have and adopt it more, refine it more, so that it's more widely available for people in different tiers, as well as it comes in different languages, so that patients of all sorts of backgrounds are able to use it more effectively, and also improve the accuracy of such devices that we already have, so that they work more effectively. Definitely. So that would be a great thing to see in future. So my next question would be to Dr. Chadha. Sir, as you said before, that adherence to medication and exercise schedules is essential for patients post care, and such remote monitoring devices help us, detect those all throughout. So how can remotely monitoring has improved the overall prognosis for sure, but what still is there that is required in this development aspect? What do you feel in your experience that what more these devices can do in cardiology for improving the patient outcome? Over to you, sir.
Thank you, Dr. Savant. I think I've spoken a lot about the heart rate and blood pressure monitoring. Let me take you all back to basics. Um, in a busy or in a big city like Bangalore, traveling is very difficult. And when the patient goes on discharge, we have patients coming from different cities and different states to us for management. When patient goes back home, patient is lost and the relatives are equally lost, because one, if the lightning has struck, he's come with the acute heart attack, they don't know what has happened and they don't know what the future course is going to be. Now, they would certainly like to be connected with the primary doctor who treated them, but that's difficult. So we need to have a platform where they can reach out to a team of doctors or a team of healthcare workers who will, number one, explain the disease, number two, tell them about the medication which they are taking, and number three, remotely monitor them. It's not that when patient goes back home, he does not have symptoms. As Dr. Shenoy was pointing out, these patients can develop fever, these patients can develop breathlessness, these patients can develop side effects of the medication which have been prescribed, because we discharge these patients on blood thinners, and some of these blood thinners are very, very strong. So there are certain alarming symptoms which come with these medication, which have to be acted upon immediately. Because if you don't do that, the patient can have very grave consequences, or the disease course can turn very, very ugly. So we need, through telemedicine, a platform where the patient and the relatives can be explained about the disease. More importantly, they can be explained about the medication which they are taking. Now, remote monitoring tools, they are plentiful. To start with, heart rate and blood pressure is all right, and the sleep rhythm is all right. But all the other tests which we need have to be done, executed through an agency, because we can't burden the patient with glucometers or PT-INR monitors. But we need a platform where the patient has to be explained each and everything, and he gets an access. So that access you get through telemedicine, where the patient presses a button and he ends up in a platform where he's explained everything about the disease and the new symptoms which have come up. And the team in turn can get in touch with the primary doctor who's treated this patient and can reassure the patient that whatever has happened, there's nothing to worry. Now, we are all forgetting that most of the patients need to be on cardiac rehabilitation, but it is sad that only maybe 1 out of 10 patients who get discharged comes back for cardiac rehab to the hospital. So rehabilitation has to be done through telemedicine, wherein the patient gets guided by the physiotherapist or the yoga instructor or the nutritionist. You'll be amazed that almost less than 5% of the patients getting discharged from the hospital know as to what they have to eat, what their diet should consist of, what are the things which they should not be eating, whether the patient has a cardiac disease or has diabetes. They and the family members are completely ignorant. So we have a tremendous potential of using the telemedicine as a platform to educate the patient and the family, because as I told you, the disease treatment offered in the hospital is just a point care. The disease can progress, it can recur, because we are just suppressing it. So it needs to be reiterated that certain lifestyle measures have to be adopted with continuous monitoring, which is possible only through telemedicine, and having a group of healthcare workers essentially constituting of nutritionists, psychiatrists, as well as pharmacists and yoga instructors, who can thereafter alter the course of the disease towards healthier lifestyle measures.
Thank you so much, sir. That was so nicely explained and so simply explained for all the viewers and for me. As you said rightly, that the care that we get in hospitals are point-based care, so there is definitely, as you pointed out, a big need for patient education. Post care as well, educating patients about the disease, about the sort of medications that they are taking post treatments, as well as the necessity and the interactions of the drugs with other drugs that they may be having, as well as working towards a more holistic approach in patient management rather than a treatment based approach that we had for the longest time. So in the holistic approach, we focusing more on the diet, lifestyle, interactions of the drugs with each other, and also patient education and education of the relatives as well, how to manage the lifestyle all around your after your surgery and everything. So definitely that is something that we need to work on and strengthen more and more, as rightly pointed out by you. Next, next question would be to Dr. Raghunathan. Sir, as you said that we have such remote monitoring devices that improve the quality and efficacy of care post neurosurgery. I wanted to know if there are other ideas that you would have as a clinician working in this field to improve the cost effectiveness, the compliance, and the comfort, the ease of use of such devices even further. And if we already have such devices, then how to adopt them more widely all across different specialities as well. So over to you, sir.
Right. Uh, See, telemedicine has a biggest advantage that it covers the distance, right? So usually now actually in neurosurgery with more subspecialization inside the neurosurgery, we have this concept called telementoring or proctoring. So here, the senior neurosurgeon, he will be in the tertiary care center. He will be training the his junior neurosurgeons or residents in the remote place where they have a similar kind of complex case. They don't know how to they have problems in decision making and then surgical strategy, etc. So here, from the tertiary care center, we can train the young neurosurgeons to manage the patient accordingly. First thing. Second thing is, as other doctors has pointed out, that it's a continuum of care. So once the patient gets discharged from the hospital, for the follow-up, we can reduce the patient's travel time and distance as well, as we can uh, as well as well as we can uh, extend the follow-up duration. For example, maximum for the post-surgery patients, we could get the patients for follow-up for at least 3 months. But for a few patients from overseas, they could not travel so long to the primary care physician for the follow-up. So these tools can be utilized for the continuum of care, the follow-up, whether there is any tumor recurrence or they need for any adjuvant therapies, or they can be managed in the local hospital. All those things can be covered up. And then, as I pointed out earlier, this intensive care, there's a telemonitoring. Telemonitoring can be coupled. The digitized devices can be coupled to the computer, and the primary point care provider, he can monitor the patient's vitals through those devices. For this, we need to develop a better telecommunication infrastructure and high-speed interconnectivity, which is lacking in rural areas. Suppose if we come up with the policy makers, if they come up with some plans to develop the information and technology sector, it would be quite useful in telemonitoring the neurosurgery patients.
So those were some very valuable points that you put out. regarding the scope of improvement in neurocare and connected care in this field. Definitely, I hope the voice gets out and the concerned authorities do pay attention to all the points discussed today, and effective measures are being taken to develop such devices which are more advanced, more sophisticated, and reach far wider audience in India. So, although I am a dentist and a public health specialist by profession, but I've always been interested into technology and healthcare together. So, my next question would be to Dr. Shenoy. Sir, robotics in surgeries have been the it since the time I have been studying in my UG, in my PG. So, what is the extent of use of robotics in cardiothoracic and vascular surgeries that you use in your in your practice, both in India and abroad? What would be the extent? And what sort of limitations do you feel still exist while using these devices, such as robotic arms, to perform surgeries in today's time? What all we can improve, and what are the basic advantages of using such technology in surgery rather than the traditional surgeries that we have? So what is the added advantage, and how can we better this technology, and what do you see of this in future? What do you foresee? On to you, sir.
Thank you very much, Dr. Savant. That's a robotic surgery is a totally new field that is really taking over the surgical world. There are centers in the world, even in India, there are about handful of centers which are using robotic arms to do cardiac surgery. Robotic assisted direct coronary artery bypass grafting, RADCAB, is a well-known established procedure. And obviously, I'll take your last question first as to what are the advantages of robotic surgery. First advantage is incisions are small. There may be multiple incisions, but they are all very small incisions, so the pain is less. The biggest concern in cardiac surgery, traditional cardiac surgery, is sternotomy. Patients are worried about sternum giving way. We are worried to take down both internal mammary arteries because we worry that ischemia of the sternum can make it give way. We are worried to let the patient drive for about a month because we are worried that the sternum might give way. So all these fears of sternotomy and the morbidity that is associated with it is gone when you are doing robotic surgery. There is no question of splitting the sternum. Smaller incisions means lesser pain, better cosmetic results, and less chance of infection. Sternotomy chance of, as I said, infection are not there when it comes to smaller incisions. Bleeding, I wouldn't say is a great advantage. There can be bleeding when you do cardiac surgery, whether be it in robotics or by open traditional method. Apart from that, I'll take your next question as to what are the limitations of this. Now, the robotic surgery, there are about Da Vinci system is one of the most accepted system in the world. And here you find the surgeon is sitting in a console separately and is operating, whereas the robotic arm is inside the OT with the patient. So the surgeon is in a console which is remotely located from the operation theater. Maybe just outside the operation theater in most of the cases, but definitely he is not next to the patient. Now, the limitations of this is the cost. Da Vinci system costs quite a lot. And once we use this system, the cost of surgery goes up. And whether the advantages that I said are really worth the cost that can be explained is something which is left to the customer to decide whether he is willing to shell out much more money, almost double or 3 times the normal cost, because of the cost involved. The next thing is usability or awareness and training of the surgeons. Now, the reason why most of the surgeons are not using it is there is no exposure to it. One, exposure is not there because of the training institutions do not have the robotic arms. Only when training institutions can have the robotic arms, the students who passed out, the cardiac surgeons who come out of these institutions will be well trained in robotic cardiac surgery. So all this boils down to the cost. So if the cost comes down, then you will find more and more training institutions will purchase the robotic arms, and you will find more cardiac surgeons getting trained in it, and you will find the overall cost coming down, so it can be used more widely. Apart from this, I find robotic cardiac surgery has uh, very good option, is a very good option in cardiac surgery, has got fantastic future in cardiac surgery. We only have to wait to see the cost coming down, and more cardiac surgeons starting to use robotic arms.
Very nicely explained, sir. Thank you so much. Both for our viewers and for me, we were able to relate and understand it so much easily. And now that you have explained, adding on to the same thing that you pointed out, that the cost would be the biggest limitation for adopting such advanced method in surgery. How do you feel? How do you think we can reduce the cost and make this sort of technology more acceptable and more widely available? Definitely, working with the national health authorities and national health centers would be one thing, but anything that you would want to add in your expert opinion on the same? How can we make it more accessible?
Dr. Savant, like I said, as the number of people are more and more number of people start using this, and more of institutions start purchasing this, then automatically the cost will come down. When they are manufacturing only a few units, then the cost is going to be high. But when they start manufacturing it in bulk, you will find the cost will start coming down. And for that, it is only a question of time. Over a period of time, I'm sure in India at present, they say there are about 70 Da Vinci systems that have been installed in various private and government institutions. And there are about more than 500 surgeons who are trained and are capable of using the Da Vinci system. So these numbers have to go up. The number of surgeons using it, the number of institutions which have installed this system, as it goes up, the cost will come down. And it's only a question of time.
So, how are the trends of India compared to the West? I see many people being prescribed to get surgeries, advanced surgeries done from the Western countries as compared to India. It is not that we lack expertise or we lack infrastructure in our country. We definitely do have both. We have expert doctors, specialists, as well as we have good hospitals. But again, what sort of technology do you feel in cardiothoracic and vascular surgeries does the West have in terms of advanced devices and monitoring devices and surgery devices that we in India still lack?
And Dr. Savant, I don't think technically we are inferior to the Western world. I think Indian surgeons are some of the finest surgeons you can find anywhere in the world. And many of these big institutions which are well reputed in the world are headed by many Indian cardiac surgeons. So I'm not saying that technical abilities are in any way less in the Indian subcontinent. We have great surgeons who are technically very skilled, and the best example is to see the big names in political world are nowadays not going abroad for surgeries. They are continuing to have the procedures done in our country. But yes, like you said, expensive equipments like the Da Vinci system for robotic surgeries may not be widely available in the Indian subcontinent, which are maybe more available in the Western world. But I think it is only a question of time. By the time, I think with that, India also will be able to catch up with the Western world as to number of robotic systems that are installed in our country. Number three, when you said monitoring, I think there we lack. We lack in remote monitoring, which the West has actually has got a wonderful system put into place. They have a system wherein there are doctors, wherein there are 10 to 15 nurses who are specially trained to answer the questions of patients, post-operatively, be it in cardiac surgery or angioplasty, cardiology, or any other system, neurosurgery, Dr. Raghunathan was saying. And all these patients have got a set of nurses and doctors who are well trained, who know the answers for all their questions, and who can give them very good feedback as to what is happening and how their recovery is happening. This area we lack a little bit. I think Indians can improve their telemedicine and telecommunication. And it is only, again, if we can do that, it's only a mindset of the patient as well as the doctor. If we can do that, I think we are in no way less than the Western world.
Definitely, sir. So wisely pointed it out that I feel like identifying the gap is the first step towards eliminating the gap. So we knowing what all places we need to improve definitely makes us one step ahead into improving and already implementing those changes. So definitely I see India advancing more and more in the field of connected care in future, in near future, of course. So, as the topic for today is Connected Health Summit, for this Connected Health Summit on the occasion of World Health Day, I have this last question for all our panelists, and it is a hypothetical sort of question that if resources such as money and time were not a constraint, and we could have any device made possible in your field, what sort of remote wireless portable etc monitoring device you would want to see? What kind of device would it be? So I would start with Dr. Suchismitha, ma'am. uh, the same question would be to all our panelists. So, if resources such as time and money were not a constraint, what sort of remote wireless monitoring device would you want to have in your field? The perfect
I
device.
think with the advent of AI and all the hype around metaverse, if we could manage patients remotely via this, it's going to give us a lot more freedom and a lot more scope to improve the overall medical healthcare post discharge. So, yes, that's something that I would like to see in the future.
So, for you, it would be a remote monitoring device which would monitor all sorts of parameters, if I'm not wrong.
Yes. In
Yes.
terms of
Okay.
the medical field, it's the usual things. We need the temperature, the pulse, the blood pressure, the sugars, their drug chart, the drug compliance, any interactions. So these are the things that we would like to assess, and probably going forward, even their exercise indicators, their sleep indicators, even these things. Yes.
Great, that sounds great. And that definitely sounds achievable to me because all the devices that we have coming up these days regarding telemedicine and telehealth and remote monitoring are definitely advancing in multitude of ways. So the same question would to Dr. Chadha now. Sir, in your field, in your specialty, if money and time and these resources were not a constraint, what sort of device, a wearable portable device, a Wi-Fi sort of device would you want to have, and what sort of things would you want it to do? Over to you, sir. Sorry, sir, you're on mute. So if you could just unmute yourself.
Okay.
Yes.
I was smiling because we are talking about devices. You need a device. You just need a smartphone. Smartphone with Wi-Fi connection. The biggest gap in healthcare delivery system is communication gap. You don't need devices to monitor heart rates, blood pressure, SpO2, etc., etc. 90% of the patients don't understand what they are suffering from. 90% of the patients don't know the drugs which they are consuming. 90% of the patients don't know what food they are supposed to eat. And a similar number of patients have got relatives who are absolutely lost. And then you have Dr. Google, who goes about telling them that you're going to die in very short span of time. You've had a major issue with your health. So if you have to give each patient going out of the hospital, tell him to have a nice smartphone which keeps them connected, which acts as a umbilical cord to the hospital. And in the hospital, you have a cabin where you have 4 or 5 people sitting, which keeps all your patients connected. The world is very small, and the COVID pandemic has made it even smaller. Acceptance of these devices, remote devices, has increased tremendously. People don't like to come back to the hospital post discharge within 7-10 days. And if you get them addicted, you create your own cohort. You have your own cohort of patients who will swear by the institute in which they've been treated, by the doctors who treated them, because there is no communication gap. So my choice of device is going to be an instrument which removes this communication gap, explains the patient what he is suffering from, makes him understand the importance of medication so that he's compliant. All the red herrings which he raises are addressed to, that is road to health. That is road to health.
Definitely, sir. Thank you so much. Some words of golden wisdom that I heard right now, and I feel so fortunate to be interacting with all the leading experts in this field today. So, definitely, sir, removing the education, the information barrier that we have between doctors and patients, or with between disease and patient as well, is the biggest step that we would want to work more and more in future. And empowering people with knowledge is the biggest empowerment that you can do, for sure. Empowering them for their health, educating on health as well. So our mission at Voice of Healthcare has always been this: to spread awareness, to spread knowledge. And we hope in future more and more such measures are being taken to remove this lack of information that patients have with diseases. The same question to you, Dr. Shenoy. If resources were not a constraint, what sort of device you would want in cardiovascular surgery? What sort of device, equipment, a wearable watch or something, or whatever it could be, you would like to have, and what sort of functions would you want it to do?
Dr. Savant, like Dr. Chadha said rightly, a mobile phone, a smartphone will, if it can give us an blood pressure, basic all vitals, as well as ECG, blood glucose, and like Dr. Sushmitha was saying, any equipment that can give us basic details. And we have a unit which can counsel the patients, wherein there are trained nurses and doctors who can counsel the patient. That will be more than sufficient for telemonitoring or remote monitoring of patient. But then, since you have offered cost no bar, I will also take in a Da Vinci system along with that. That will do a whole world of good.
Definitely, sir. So this question was pointed out so that we have a clear picture of what the specialists need, what our doctors require, so that the manufacturing organizations, the companies who are into medical devices and such, get this word out and are aware about the needs from the clinicians' aspects. So this was one of the things that I thought before, and it's World Health Day, and I wanted to have this sort of resources no bar sort of question, because we should have something to look forward to improve to, and to reach to in future when it comes to advancements. So that was the thing. So all up till now, we have seen this trend, this common trend that all our specialists talking about, which is one, monitoring all the basic details of the patients, the basic vitals and stats that are required in almost every disease, every surgery, every admission. So measuring that, as well as a device that can provide in education, patient education and education about the disease, the medications, and keep the patient and the relatives informed. On top of that, I would like to add from my side accuracy aspect. The more accurate the device is, the better. I have observed that, being very tech savvy, I have observed that my sleep quality that my iPhone detects is very different to the sleep quality my smartwatch detects, which is of a different company. So variations in accuracy should be, reduced as much as possible. I would want to ask the same question to Dr. Raghunathan as well. Sir, in your opinion, in your neurosurgery field, if there was this device for which there were no limitations on resources, time, and money, what sort of device you would want to have?
I would reiterate the other surgeons' comments. I just, from neurosurgeon perspective, I would like to my patient to have a smartphone with a video conferencing platform, and also I wish we could have a network between the treating hospital and the patient, so that if there is they are wired. If there is any alarm from the patient side, they can trigger the computer. They can communicate to the hospital through the network, and then they will contact the primary surgeon. So that he will attend to the patient immediately. He can triage the patient accordingly. And the other thing is, as you know, neurosurgery, the post neurosurgery patient may have neurological deficits like hemiparesis or any bedridden spinal cord injury patients. We need a virtual reality based tele-rehabilitation where the patient can continue the physiotherapy at home without any frequent hospital visits and frequent additional expenditure. These virtual reality augmented rehabilitation is of much help in bringing life back to normal in these kind of disabled patients, because in few cases like severe traumatic brain injury, spinal cord injury, patient will be disabled state. So in those situations, this tele-rehabilitation will be of much help.
Definitely, sir. That is something very interesting that you pointed out, that tele rehabilitation and remote rehabilitation services. The more we have, the better it is for patients and for doctors both. So definitely, we gathered many points to look forward to work towards on this Connected Health Summit, as well as we appreciated and understood a lot of the existing technologies in this field that we have. So I would like to thank all our esteemed panelists from the bottom of my heart for taking out time for us and sharing their knowledge and wisdom with us today on this Connected Health Summit. uh, I am very thankful to Manipal Hospitals, to all our viewers as well for staying with us through this till the very end. I wish you all a happy World Health Day, and I sign off now with stay happy, stay safe, stay healthy. Thank you so much.
Thank you, Dr. Savant.
Thank you.